Okay, this is the last class. Friday, lab day, I'll get some pizza for you. And then you can eat it and look at the colon while you're eating pizza. Isn't that nice? Yeah. Okay. All right, and today, depending on how long we go, my class starts. My night class starts at 6. So if you want to stay over and work in the lab, you can do that. All right. And then what's today? Wednesday. Okay. Thursday. If you want to come in the morning, you can do so. Friday, if you want to come in the morning, you can do so. And then Saturday, I'll be here from 9 until noon. Okay. Like anytime after 9, just go by Tom, okay, and he'll open it up for you. Okay. Okay? All right. Here we go. Okay, today we're going to finish up the nervous system. I'm going to talk to you about the eye and the ear. Say yeah. Okay? All right. Okay, just before we start, I want to tell you something. I've got some good news for you. Do you want to hear it? Yeah. Okay, so watch. What I've decided to do is this is how you shallow the club, right? It's like this, and then bringing your elbow down, that brings it like this, and it takes the angle of attack a little more shallow. So I worked on that, and it's working. That's the good news. Thank you. You thought the good news was going to be about you, huh? Yeah. Yeah, well, you've been tricked. Just so you know, guys, I'm watching you. All the time. Say yeah. Okay, real quick. Why you got 2 eyes and not one big one? That's exactly right. Are we predator or prey? Why are we predator? Where'd you learn all this? Oh, nice. There's a video on there too?
I didn't get to the video yet, but I was in there.
That's nice. Okay, so watch. We got 2 eyes in the front of our head, and that allows us to perceive depth. Do me a favor. When you leave today, make sure I'm still here or I've already left. Try driving home with 1 eye shut. See how that works out for you. All right? So it's for depth perception. Prey have their eyes on the side of their head, so they can see 360 almost. Sometimes if their hair ain't right, they can't see it in the back of their head. Okay, so here we go. I'm going to take it from the outside in. Okay, here we go. So this is a cross section of the eyeball. And the eyeball is divided into 2 parts. It's divided, everything in back of the iris, the color part of your eye, up into the retina, is called the posterior chamber.
Is it iris to the retina?
Yep. And the posterior chamber is filled with a clear jelly substance called vitreous humor. Vitreous humor helps maintain the shape of the eye. And it is like, it's a clear protein gel, so your eyeball doesn't collapse. And everything in front of the iris and in back of the cornea is the anterior chamber. So I'll color it in blue here. This is the anterior chamber of the eye. And the anterior chamber of the eye is filled with a clear fluid called aqueous humor. Now, is the cornea alive or dead? Do you see any blood vessels going through your cornea? Do you see little red blood cells going through your field of vision? So is it alive or dead? You've been tricked. It's alive. Listen up, because this is true. One of the functions of aqueous humor is to nourish the cornea. So the aqueous humor fluid is clear, but it has tiny nutrients in it that allow the cornea to maintain life. Say yes. So the cornea is translucent protein, and the function of the cornea is to bend light, refract light, and focus it on the retina. Now, in most people, the cornea is round, but there are some people who have a cornea that's shaped kind of like a football. And in some cases, it actually has laces on it. So this football-shaped cornea results in what's called astigmatism. You know about this? Right? And then what they do is they do what's called radial keratotomy. What they'll do is they'll take a laser and they will make radial cuts in the cornea to reshape it, to work out that astigmatism. Say yeah.
Is that when it's like reached a certain point of severity, or they offer it all the time?
No, they can do that any time they want. So what it does is allow you not to use glasses or to reduce the strength of the prescription of your glasses.
And the interior chambers from
The back of the iris to the retina. That's posterior chamber.
no, it's the interior. I was asking.
Anterior is from in front of the pupil to the cornea.
Okay.
And it's filled with aqueous humor. Say yes. Okay. Now, watch. The lens is made up of concentric rings of translucent protein, clear protein. Here's a little better picture of it. So this is the lens right here. And you can see it's got these rings of protein. And the lens that you're born with is the lens that you die with. And remember that the shape of the protein determines its function. So as people get older, the protein that makes up their lens becomes denatured. And as a result, you start getting clouding in your lens and you have cataracts. Say yeah. Okay, now watch. If you have like a camera, right, like with a telephoto lens, the lens that moves in and out, what that does is that allows the camera to focus on things that are near away or far away, yeah? Well, your eyes don't go in and out. Instead, the lens is suspended in back of the iris by these little suspensory ligaments, these little strands here. And they're connected to a group of muscles called ciliary muscles. And ciliary muscles, their function is to change the shape of the lens. So by contracting and relaxing, it can thin out the lens or bulk it up. And this allows you to change your focal point. That's why we can look at something very close and then look far away and immediately focus on that object. And that object is called, or when you're able to do that, that's called accommodation. And accommodation decreases, obviously, as you get older. Okay, now watch. Within the ciliary muscles are a group of cells called ciliary bodies. They're a group of cells within the ciliary muscles. And that group of cells in the ciliary bodies produce aqueous humor. Are you with me? So, watch, I'll show you a little better picture here. So let me show you where you are right here. So here are the ciliary bodies along with the ciliary muscles. And this structure right here is the iris. And the pupil is the opening where light comes in and is bent by the lens, right? So the opening in the iris is the pupil. So ciliary bodies produce aqueous humor, and it flows through the pupil, and then it nourishes the cornea and removes the metabolic waste. Now, in the corner of the cornea, there is a group of drains called the canals of Schlemm. And the canals of Schlemm drain the aqueous humor. And then that aqueous humor is returned to the venous blood. Now, in some people, especially diabetics, who have problems with protein metabolism, protein debris can begin to build up, and it can block the canals of Schlemm. So this is what happens. The ciliary bodies continue to produce aqueous humor, but it can't be effectively drained. And the production of aqueous humor is what contributes and ultimately what determines intraocular pressure. So if you've ever had your eyes examined, then they do that tonometry on you, where they do the little puff of light or puff of air. You ever have that done? Yeah, no one likes that. That's called tonometry, and that can measure the intraocular pressure. Who's with me? Now, normal intraocular pressure should be less than 25 millimeters of mercury. So watch. Watch. Yeah. The retina is living tissue, and it has a blood supply to it. I'll get to that later. But as intraocular pressure begins to build up, it will cut off blood supply to the retina. Tell me you got that. So the first part of the retina to start lacking blood supply is the perimeter of the retina, the periphery of the retina. And then as the pressure builds up, the person's vision starts to become smaller and smaller, where they get nothing but tunnel vision, and then ultimate blindness. And that condition is called glaucoma. Heard of it? Yeah. Now, the best treatment for glaucoma is not to get it. You should write that down. Are you writing that down? Okay. But watch. The second best treatment is THC, tetrahydrocannabinoid. So it is not uncommon for an ophthalmologist to write a prescription for one big fatty. So you can be cuckoo for Dopo Puffs. One of the things that THC does is it dilates the pupils. Like, you ever smoke pot and then like you go into a bar or something like that? It's like you need a welding shield. It's like you're on the surface of the sun or something. See, yeah. Did I ever tell you those times I smoked pot 3 times in my life? Did I tell you that?
No.
The first time when I was 19, it was my 19th birthday, so I smoked pot, right? And then my buddy's telling me, he's like, "Tim, my mom's having heart surgery." I'm like, and I'm like cracking up, right? And he goes, "You're wasted, right?" And he goes, "Shoehorn." I'm like, everything was funny. And then I told you I played baseball in college, right? So I was a sophomore at the time, and then we had buses, and the juniors and seniors would ride on their own bus, and then the coaches, sophomore and freshman, had to ride on the bus with the coaches. So they said, "Tim, if you win today, you can ride on the bus back with us, and we'll smoke a little pot." So I'm pitching my heart out, right? And we ended up winning. So on the way back, I'm sitting in the front of the bus, right? And they got a joint, and they pass it around, and I take a couple hits off of it, right? And then about 15 minutes later, I turn around, I'm like, "Stop throwing stuff at me." They're like, "Nobody's throwing anything at you." I go, "Knock it off." So we'd always stop at a restaurant, right? So I go to the captain, I'm like, "I can't go in there." And they're like, "Why?" "Everybody's gonna know I'm high. Just buy me some food and bring it out to me." And man, I was so paranoid, and that's the last time I did that. That sucks. Like, I want that like mellow high where your face feels kind of like flushed, and you're like, right? Anyways, here we go. THC reduces aqueous humor, and that's why it's used as a treatment for glaucoma. So the medical use of marijuana, one of the treatments is for glaucoma. So you can puff, puff, puff. I go out to Seattle every year. I have to give a presentation to their Chamber of Commerce. So I wear a suit and a tie, and I use words like clearly and invariably, you know. Anyways, so I'm staying at this hotel, and it was at this big convention center. So I'm just walking down the street, and I see a cop across the street, and I see this dude just sucking on a joint. So the dude's sucking on a joint, I can smell it, so I walk up a little closer to him. Anyways, I'm looking at the cop, I'm like, and then I realize that it's legal in the state of Washington. I didn't know that. How many of you guys smoke pot here?
You and you alone.
Yeah, right. Yeah. Some of the students that they smoke pot before this class because they come in all glassy eyed, you know, they're like, I get it. Okay. All right. Watch. So I explained that to you, yes? Ciliary bodies produce aqueous humor. Ciliary muscles are connected by these little suspensory ligaments that change the shape of the lens. The function of the lens is to bend the light and focus it on the retina. Watch. This is the retina. You got me? And the retina has a group of specialized cells that allow us to take photons of light and then convert it to electrical impulses. And those two specialized cells are called rods and cones. And how you remember this, cones, color, right? And they're for sharpness of vision. And the greatest concentration of cones are focused on what's called the fovea, or the Fovea Centralis. The fovea is where when you're looking at something directly, the light will be focused on the fovea, and that's where the greatest concentration of cones is located. That's why when you look at something directly, you have the greatest sharpness of vision. And then as things start moving out into the periphery, things become less detailed. Say yes. So as you move into the periphery, less cones are there, and more rods. And rods see in dim light, but they're not very sharp. That's why the darker a room, the harder it is to distinguish color because you're not activating cones. Say yes. Now, you have this thing called the optic disc. This is the coolest thing ever. When you get into advanced, I'm going to explain to you fetal circulation. I think that is just incredible. And this is too. Watch. Write this down. The optic disc is where the retinal artery, retinal vein, and optic nerve exit the back of the eye. So the optic disc has no rods or cones. So to the left and right of your field of vision, there should be a circular black spot, but there isn't. That's because the occipital lobe interpolates what you see. That's a fancy way of saying it fills in the missing pieces of information so that your field of vision is continuous. Don't you think that's cool? I think so. So watch. How many people know somebody who's diabetic? All right, what do you want from me? Okay, watch. The retina is the only place in the body that you can see blood flowing through an artery without having to cut somebody open. So one of the things that happens in people with diabetes, unlike any other disease, is they start getting cholesterol plaque buildup in these small arteries. Also, these retinal arteries will rupture and you will get aneurysms. And as a result, if you're not supplying blood to that retina, then the field of vision gets really jacked up. So they get what's called diabetic retinopathy as a result. So a lot of times, if the ophthalmologist sees like a aneurysm on a retinal artery, they can use a laser and they can seal that aneurysm shut. That's why people with diabetes have to get an annual eye exam, dilated eye exam, to make sure that that's not happening. Diabetic retinopathy. That would be a good word for name for a rock group. Retinopathy. Say it for retinopathy. No? You don't care, do you? You just want me to keep going through the stuff, right? Okay. Fine, be that way. All right, so that's the retina. Say yes. Rods and cones. Where's the greatest concentration of rods and cones? The Fovea Centralis. Say yes. Here we go. What's this? I ain't pointing anywhere. What is that? Just think if that was like a picture on your wall. Would you want that on your wall? You walk in the room, turn on the light, hey. Right? What if you're naked too? You'd be like. Here we go. The iris is the colored part of the eye. And now watch. Nobody's iris is one complete color. And here's why. The iris is made up of circular bands and radial bands of muscle. So the circular bands of muscle are here, and the radial bands of muscle are on the outside. You got me? And those circular or radial bands will contract or relax, and that will determine your pupil size. Now watch. What does sympathetic stimulation do to the size of your pupil? It makes it bigger, right? So under sympathetic stimulation, when you are scared, the circular bands of muscle will relax and the radial bands will contract, and that opens up your pupil. Say yeah. When you go night-night and you say your prayers, God bless Timmy, parasympathetic is going to cause the circular bands of muscle to contract and the radial bands to relax, and your pupil gets smaller. Say yes. Does that make sense? What determines your eye color? Huh? Blue jeans? Watch. What really determines your eye color is the amount of melanin present. So people with darker skin tend to have darker eyes. Melanin is protective. You got me? We didn't talk about the skin, but look. People originated at the equator, which has the greatest concentration of light, sunlight. So they needed more melanin in order to protect their skin. As you move away from the equator, the people's skin becomes lighter and their eyes become lighter. Say yes.
When you do a pupillary response, are you checking for cranial nerves?
Yes. Yep. And because they're cranial nerves, one of those signs is increased intraocular pressure. So somebody gets hit on the head and they got a closed head injury. If the bleeding is inside the skull, it will compress the soft tissue of the brain, cutting off blood supply. So that's why you do it. Can I show you a clinical application for this just real quick? One of the things that a doctor will do when a patient comes in and they're unconscious.
Can you hold that skull?
You got a problem with me, sister? A doctor and an unconscious patient, not knowing the history, one of the things they'll do is they'll open up their eyes and they'll look at the size of the pupil, and then they'll take that pen flashlight and they'll...
Fixed and dilated?
Yep. So watch. If they take a drug like they've overdosed on cocaine, how does cocaine make people act? Right? So it's going to mimic the sympathetic nervous system. So the pupils initially will be dilated. Tell me you got that. If you've taken barbiturates or heroin, what does that mimic? What do those people on heroin want to do? Run a marathon? They want to sleep. So their pupils will become pinpoint. And that will determine what antidote you will use. Say yes. That's why it's important to know that. Okay. You need to get this. Where is it? Where's your lacrimal gland? It's on the inside of the upper eyelid. Say yes. Watch. If you have a window, you're not going to start cleaning it here. So the lacrimal gland, you cry boo-hoo. Oh, yeah, oh, yeah. Watch. And there are little canals here that will drain the tears into the nasolacrimal duct and out your nose. That's why little kids, when they don't get the G.I. Joe with the Kung Fu grip, they're like, say yeah. And watch, and I explained this before, cold air has less moisture. The cornea has to be kept moist. So when you go out in cold air, the lacrimal gland will release tears, drain into the nasolacrimal duct. That's why your nose runs when it's cold out. Say yeah. Don't you think your nose should have been turned the other way? That way the boogers would just kind of, you could feel them bubbling up, and then you could clean it. My ex-wife was Korean, right? And she had these perfectly round nostrils. And I wanted to make a mold clay and use them as a pencil holder. I told her, you got pencil holding nostrils. Okay. Watch. Eyelashes are hair. So they have sebaceous glands that release an oily mixture called sebum. If one of those sebaceous glands becomes infected with bacteria, you get a stye. Say yes. It releases some like waxy stuff, and that's why you get eye boogers in the morning, because you sleeping. Say yeah. And you can tell if you're dehydrated too, because your eye boogers in the morning are dry. If your eye boogers are dry, you're dehydrated. Write that down. Never forget it. What did I learn in class? Dry eye boogers means I'm dehydrated. Okay. Did I cover all the parts of the eye?
Wait, I have a question. What's the little tissue, like, I don't know, sometimes, like, I have, like, a little layer of, like, tissue. Like, what's that from? Like, in your eye, like, in the morning, you can't see for a minute until you, like, blink.
Oh, that's the secretions from the sebaceous glands of your eyelids. Yeah, it's like a little film, right? Yeah. Yeah, it's no big deal. One of the ways to reduce that is to read the textbooks.
Timmy, you did an optic disc, but did you do optic nerve?
Oh, okay. All right, very good. All right, watch. Quit yawning, this stuff's exciting. And again, you think you want this semester over with? Anyone want to take the final now? The optic nerve takes the electrical impulses that were created by the rods and cones and transmits it to the occipital lobe of the brain, where it's interpreted into visual stimuli. Say yeah. So where's the visual cortex of your brain? Where is it? I'm waiting. What? General A&P, Gateway Technical College. I'll just tell you, it's the occipital lobe. What did I just say? Oh, the optic nerve transmits the electrical impulses that were created by the rods and cones of the retina to the occipital lobe of the brain, where it's interpreted into visual acuity, right? Visual stimuli. Watch. Here's the other thing. I think this is pretty cool too. The focal point, if you've ever had physics, anybody here ever have physics? Guys? No? You should take physics. This person is upside down and anorexic. Watch. The focal point, hang on. Son of a, of the retina is short. So when you focus an image on the retina, it's actually, oh wait, that was upside down. Turned upside down. So dude was upside down, and when you look at it, it's focused on the retina right side up. So the focal point is so short in the eye that the images on the retina are inverted, and then the occipital lobe turns it right side up. Say yes. Don't you think that's interesting? I could tell.
But why?
Why does it do that?
Yeah.
Well, because then you'd be seeing everything right upside down.
No, I mean, why does the focal point being short cause it to be upside down? Why does it,
Oh,
does it focus upside down in the retina?
in order for it to be right side up, the focal point would have to be, for your eye, would have to be like somewhere out here. So your eye would have to stick out this far. In order for it, and I don't want to get into it, all you need to know is it's inverted. That's it. Take physics just to learn that. Tell me you got that, guys. Okay. I should have just posted a video. I could have been hitting golf balls today. I was killing it. Okay, here we go. That's the eye. Did I cover all the parts of the eye? This is the ear. Yes? Why you got two ears and not just one big one? Like a radar disc. Why? You watched the video.
I don't remember. I studied it a lot. Can't retain it.
Jalissa Alvarez studied a lot, and
Because our
she
TV
can't retain it.
So like if I don't know how to explain it. So it's like she's talking to me. I'm only gonna hear it from where I won't know where it's coming from. Something like that.
Yeah,
No?
I better explain it.
I know, but it's like
Yeah, you're right. You're right.
Something.
You're sort of right. Watch. You got two ears, one on each side of your gourd, because if there's a killer over there, and the killer says, "I'm going to kill you," that sound wave will enter this ear first. It will resonate through your skull bones and enter this ear just a split second later. And the temporal lobe of your brain has the ability to triangulate the direction of sound and determine where it was coming from. Tell me you got that. Unless you're trying to find what? Okay. Watch. The problem arises when the killer is directly in front of you or behind you. Then you can't determine direction. So what you need to do is ask the killer to take a step to the left or right and then repeat the fact that you're going to kill me. Then you know. Tell me you got that. So evolutionary, it's a good thing that we got two ears, because that allows us to know where it's coming and run the other way. Watch. Have you seen this? Like they found the Virgin Mary in a pizza, the picture of the Virgin Mary in a pizza, and there was a picture of Christ, an image of Christ on a piece of French toast, right? Watch. This is evolutionary. Do you understand? Our brains are wired to identify faces, because that will determine whether or not, hey, I know that guy or I don't know that guy. Do you understand? That's why we look at images and we see faces on it.
So what causes the ringing in the ears?
Real simple. Lack of textbook reading. I don't know. Why, do you have that? I have that too. The problem with the ringing, they said it was from what? A concussion? Yeah, it should have gone away. Well, nothing I can do. The thing is now with the ringing, I hear voices too. Right? Like read the textbook. It's starting to haunt me. Keep me up late at night. All right, here we go. Watch. This is the auricle. The auricle is also make cookies for Neil. Do you see how this is all coming together? Say yeah. The function of the auricle is to is to funnel sound waves into the external auditory canal. You got me? The external auditory canal is lined with skin, but it doesn't have sweat glands. It's got specialized glands that produce cerumen or earwax. And earwax is protective. And know this, the skin of the inner ear sloughs off from the tympanic membrane out. So the ears are self-cleaning. Do you understand that? When you put a Q-tip in your ear, you compact the earwax. The result is that when the skin sloughs off, it will not be able to remove that compacted wax. So the old thing, you'll learn this when you get into clinical. You never put anything smaller than your elbow in your ear. Meaning you shouldn't be putting stuff in your ear. How many people use Q-tips? Yeah. I'm taking points off.
When you have an ear infection, where part of the ear is like, where is that hanging?
The ear part. I'll explain it in a minute. Ready? Okay, watch. Separating the external auditory canal from the middle ear is a thin translucent membrane called the tympanic membrane. So the tympanic membrane separates the external ear canal from the middle ear. Write this down. The middle ear normally should be air-filled. And the tympanic membrane seals the middle ear from the external ear. And the tympanic membrane is connected to the three auditory ossicles, which is the malleus, the incus, and the stapes, or the hammer, the anvil, and the stirrup, right? You learned that in 9th grade biology. Remember that? Now watch. Connecting the middle ear to the nasopharynx is the auditory tube or eustachian tube. And surrounding the eustachian tube are muscles. And normally, those muscles are contracted where the eustachian tube is closed off. And the purpose of the eustachian tube being connected to the back of the throat is to equalize the pressure in the atmosphere with the middle ear. So when you go into a plane and they pressurize the cabin, you need to equalize the pressure in the middle ear. If you don't, it can rupture your eardrum. So what they do is they tell you to chew gum or swallow, and that will relax those muscles and open up the eustachian tube and allow the middle ear pressure to equalize with the external ear. That's why they tell you if you got a middle ear infection, not to take a plane ride, because it could rupture your eardrum. So when you get an ear infection, what you're really getting is you're getting an infection in the middle ear. Tell me you got that.
Is that all ear infections?
Not all ear infections, the 90% of them. You can get an inner ear infection, and that can produce vertigo. Anybody here ever have vertigo? Your husband's got it?
It messes up with your balance, right?
Yeah, it causes the room to spin and stuff.
Does that ever go away?
What's that?
Does that ever go away?
Vertigo? You better hope it does. Otherwise, you're going to have to spin the opposite way the rest of your life.
Where is the station?
Right here, it connects the nasopharynx with the middle ear. All right? Now watch. We'll show up a little. Here's a blown up version. Here's the tympanic membrane, and then you have the malleus, the incus, and the stapes. The function of the malleus, incus, stapes, and tympanic membrane is to amplify sound waves. Again, a little physics move, and I ain't got time to go into it. Now watch. These are the smallest bones of your body, and they articulate. They form joints. So when sound waves come in, it's going to vibrate the tympanic membrane, and then the auditory ossicles will vibrate. It's very important that you get this next statement. The stapes is connected to the inner ear. The stapes is connected to the inner ear by a thin membrane. You got me? So watch. Hang on, let me get a video working here. Let me come back to this one. Okay, here we go. Watch. Study, 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 study. So as sound waves enter the external ear, it's going to cause the tympanic membrane to vibrate. The 3 auditory ossicles will begin to vibrate, and connected to the inner ear is the stapes by a thin membrane. You got me? Write this down. The cochlea is fluid filled. The cochlea is fluid filled. And when you throw a rock into a puddle, it will create fluid waves. So when the tympanic membrane begins to vibrate and vibrate the auditory ossicles, it will create a fluid wave inside the cochlea. So these sound waves are transferred into fluid waves within the cochlea. Who's with me so far? Is anybody following this? Anybody? Guys?
Yeah.
So watch. Here's some more physics coming at you. Which sound wave has a greater frequency? A or 2? A. The bumps occur more frequently. You got me? You better write this down. Higher frequency sounds have a higher pitch. Lower frequency sounds, a lower pitch. Say yes. All right? If you've ever used a tuning fork to tune an instrument, you take the letter C, you hit the tuning fork, you put it on the string, and you tighten or loosen the string until the string begins to vibrate. You are now in resonance and it is in tune. Say yes. Here we go. So as the stapes, 150 strong. As the stapes begins to vibrate, it will vibrate that fluid within the cochlea. You got me? Now watch. The cochlea is fluid filled. And then there's a special area, structure inside the cochlea called the organ of Corti. This is the organ of Corti. No one's even paying attention to this, are they? Am I talking to myself? Okay. Well, I'm just going to talk to myself anyways. In the organ of Corti, there are over 30,000 individual hair cells. And each hair cell varies in height and thickness. And each hair cell responds to a certain frequency of sound. So as the fluid wave goes through the cochlea, that fluid wave is going to have a certain frequency. And as the fluid moves through the cochlea, it will resonate with hair cells in the organ of Corti that have the same frequency. Tell me you got that. So those hair cells within the organ of Corti that have the same frequency are going to begin to vibrate. And when they vibrate, they open up ion channels. And those ion channels will then create an electrical impulse. It will travel down the acoustic nerve to the temporal lobe, and you interpret it as a sound. Say yes. You like that? Watch. There are also hair cells inside the organ of Corti that I like to call loud cells, or loud hair cells. And those loud hair cells determine the decibel level of a sound, or how loud the sound is. Tell me you got that. So the louder the sound, the more of these loud hairs are activated, and in the temporal lobe, it's interpreted as a louder sound. How many people have ever gone to a rock concert? Right? Like maybe the Archies? Sugar. Oh, honey, honey. Okay. Watch. Where the heck is it? I'll just use this. In the middle ear, there are muscles that are connected to the auditory ossicles that will stabilize the auditory ossicles when you are exposed to loud noises. So if you're exposed to really loud noises, like a rock concert, how long you're exposed to that noise and how loud the sound was determines how long those muscles remain contracted. That's why after a concert, the day after, your ears, you don't hear quite right. That's because the muscles in the middle ear are still contracted, and it takes a while for those to relax. And the purpose of that is that so those bones don't become dislocated. Then you can't hear. Say yes. All right. Okay. When they put tubes in a kid's ear, where do they put the tubes? Where specifically?
To drain from the station to that membrane. Some have those. The tympanic membrane.
They put them right into the tympanic membrane. Right? So look, there's a tube in the middle, in the tympanic membrane. So if you have infection back there, the goo and infection comes out of the hole and it doesn't rupture the tympanic membrane. The body does stuff that makes sense. Should you have a little plastic tube in your eardrum? Normally. No. So once the infection is cleared up, the immune system will actually push that tube out of the tympanic membrane. A lot of times you find it in the kid's pillow. Sometimes they don't, it doesn't go out, and then the doctor just has to pull it out, and then the tympanic membrane will seal off. But repeated rupturing of your tympanic membrane will cause it to produce scar tissue, and you will lose hearing as a result. And you shouldn't be getting ear infections after the age of 5. Adults should not be routinely getting middle ear infections, and here's why. In an adult, the eustachian tube that drains the middle ear is at much more of an obtuse angle. So goo slides down. It's like a slip and slide. Hey, them goop boys. Right? In infants, babies, the eustachian tube is much more acute, so it can't slide down. That's why babies, especially under the age of 2, they're chronically getting ear infections, and it's normal. But in adults, it is abnormal. Say yeah. Do you want an ear infection?
No. I have enough problems.
Say yeah. That is, ladies and gentlemen, the eye and the ear. Did I cover everything? Did I cover all the parts? Okay. All right, do me a favor. Take a break real quick. We're going to go over muscle and bone. I'm going to tell you what I expect. Oh, yeah. Yeah, I'm getting bummed information. Yeah. Mm-hmm. Just so you know, today, it's going to be a bad day for your sinuses. Anytime the temperature warms up and then it gets cold, your sinuses are going to be jacked up.
So what in the barometric pressure makes you have headaches? That makes them worse?
Basically what happens is with the change in atmospheric pressure, the lining, that mucosal lining within the sinuses will expand or contract, and if it expands, then it'll block the little ostia, and that's why you get sinus pain. And you don't want that. All right. What was I going to show you now? Oh. Yep, got it. the hell is this? Oh. Hey, who's taking the tease test?
Soon, after this.
I got stuff for the science portion of the tease test that I put together, like earth science. You know,
Do you have to wait till we're done with this class to take?
I don't know.
I think sign up for it. I think yeah, after this class.
Oh, okay.
After they raise.
Oh.
Okay, connected to the cochlea, are the semicircular canals. The semicircular canals are fluid filled, and they contain hair cells just like the cochlea. And each one of these, I'm going to show you. I got free ham.
If somebody has like severe alopecia, so like they don't have hair, would that affect any of this or no?
Like severe alopecia, like affect what?
Because you said that there's hair cells.
Oh no, that's what they're called. They're not real actual hair.
Okay.
Yeah. Okay, these are the semicircular canals, and they're fluid filled. You got me? And each one of them is at right angles to one another. Boom, boom, and boom. So as you move your head and your body, the fluid within those semicircular canals will move. And when it moves, it will activate hair cells within the semicircular canals, and those are transmitted through the vestibular portion of the vestibular cochlear cranial nerve to the motor area of the brain and the cerebellum to allow you to maintain your balance and equilibrium. So when people get an inner ear infection, it affects the semicircular canals and it will cause a spinning sensation. That's the vertigo. So the best way I can explain how these things work is if you take a little kid and you take him by the arms and you spin him around and then you stop him, the body is not moving, but the fluid is still moving. So that's why they're... So the semicircular canals are telling your motor cortex and your brain that you are in fact moving when in fact it's the fluid that is moving. Say yeah. And your vision too is connected to the semicircular canals. That's why if you're sitting at a stoplight, right? And then yeah, most days. If you're sitting there and the car in front of you is moving up, out of your peripheral vision, it's going to stimulate those semicircular canals and it feels like you're moving. So that you put your foot on the brake, right?
Is that why when you're like in the car or on the bus or something, when you try to read, you get all like?
Yes. Yep. For that very reason, because when you're bouncing up and down, your eyes are moving up and down, and your eyes are connected to the vestibular cochlear nerve, which stimulates the medulla, and the medulla has the vomit reflex. That's why you can throw up.
Is that what causes your emotions?
Yes. Okay, take a break real quick, okay? it's not, there's always a new semester. Right?
What?
Yeah.
Did you grade the cranial nerve quizzes?
Yeah.
Because I know mine's not on there.
I'll look.
Okay.
Did I hand back those cranial nerve quizzes?
No.
Or
So
the
for
other
that
quiz.
tease test stuff, do we just email you or what?
No, I'm gonna put it on. I'm gonna put it on the bottom of the course documents.
Okay, awesome, thank you.
But it ain't gonna be until near the end of the semester because I got too much crap I gotta do.
The stuff for the tease test is added to the blackboard. Are you not the first time? Like 7 times.
Cranial nerve, if I had, okay, if I had a decent grade on that, and a decent grade on another one, those two combined are my. Summer sausage, seasonings, and jack cheese.
Oh yeah, I just saw it. Oh, here, hang on. Okay, that's that. Okay, watch, listen up. So there's no confusion. I don't want any. If you turned in those 3 quizzes, do you understand? I'm going to grade them. And then I'm going to add them up, and you're going to get a percentage, 1% for those 3 quizzes. Do you understand that? If it is higher than your second lowest quiz, I will change that grade to that grade. Do you understand? I'm not going to get any emails or nothing, right? I explained that perfectly. Good. if I get an email from any one of you regarding that, if your grade happened to be better, I'm changing it back. Do you understand? Because you're creating more work for me, and I'm trying to be nice. Do you get that?
Yes.
But my infinite patience is not infinite. Say yes.
Yeah, I have a question. Are you gonna send those something else back from the, like these questions?
Yes, look. I have been insanely busy. Insanely. And I'll be on, I'll get to them when I get to them. I should have really emailed you and said I probably won't get to them until like Sunday. I won't get to them until Sunday. I just won't, because I got to finish up my online class by Sunday. I do.
So on those quizzes that you're gonna average that we're not gonna email you about, are you going to post the average or how do you know? Plus, I mean, I don't even know. I'm not gonna.
You know what? Can we just forget that? Can we just forget that whole thing? Can we forget those quizzes?
No.
What do you mean no?
Just bump us an extra 10 just for
Who's taking the advanced class this summer? Let me explain something to you, because I want you to be, have informed consent, right? The advanced class is much different. Do you understand? Like, watch. There's no extra credit. There's no this. Do you understand? What you get on that quiz is going to be your grade. Just so you know, right? You had, 7 or 8 questions on quiz number 1 here? There's 24 on quiz number 1 in the advanced class. And if you think I'm expecting detail here, you ain't seen nothing. So I suggest that you understand what you're getting into. You are getting informed consent. There are other advanced classes being offered in the summer, just so we're straight about that. Because I don't want people going, I didn't expect this. Look at the name.
Are there videos we can watch?
And you better watch them and prepare for them. And I open up that class about a week before the class actually starts, and I suggest that you start working on that stuff. Because if I hit the ground running. You had general. Do you understand?
So that stuff that you posted for this semester in advance, like, is that gonna still be on YouTube?
Yeah, I'm not going to go there and take it down.
So we can just watch some of those?
Yeah, there's a lot of stuff. Their final is 64 questions. So I'm telling you, I admit it. I freely admit that I'm not everybody's cup of tea. So you need to, evaluate and think about what you're getting into, and maybe you want to choose somebody else. And that's okay. It doesn't hurt. It doesn't hurt me. My classes always fill. It's just odd. But I just want you to know what you're getting into, right? Because people think it's going to be general, and it ain't going to be general. It's going to be advanced. Say yes. And Timmy, don't play. Am I right? So think about it. Right? Other people are teaching advanced. If you live in Kenosha, there you have it. Who lives in Kenosha?
I'm
Sure.
taking your class. Yeah, we're not okay.
You're not gonna scare us that way.
Oh, really?
We like
In my advanced class? I had my night class tonight. I had 24 people. It's a full class. You know how many people I got now? 11. And of those 11, 3 are failing, and they're going to fail. So 8 people are going to make it out of that class. There you have it. Because that class determines whether you are an LPN or an RN. And I'm going April 20th to the little pinning ceremony they got at Madragrano building. And you know what I do? I count the number of people sitting up there. They have my general and advanced class. That's what I do. And then I ambulate. So don't hate. Ambulate. What, in the summer? I do. And just because it's a summer class, I don't make it, it's the same thing. Right? So all I'm telling you is be prepared. Because, right. If you are not knocking this class out of the park, you will struggle in the advanced class. It's that simple. Because you haven't learned the amount of work it's going to take to do well. You just haven't. So bear that in mind. Right? I had students who didn't have my general class. They came to my advanced class. And when they found out what I expected, they dropped the first day. And I respected that. Right? You knew they didn't want to do that work. So don't be that way. Say yes, guys. And passing general with me has no bearing on the advanced class. It does not. Just so you know. So, look, and I'm shooting myself in the foot, right? I'm losing students. But it fills.
How many people is there in this class?
This was full. Yeah. There should be about 15 people who make it through here. Right? Okay, that's the ear. Say yeah. Okay. And that's earth science. So after the semester's over, close to it, I'll put that stuff on Blackboard. You're going to have to go at it and get it off right away, because as soon as the class is over, like I think it's 2 days after the class is over, the Blackboard shell goes away. All right, so print that stuff off. All right?
So since you're going to open up the class starting before, they keep putting a notification that they're going to redo the Blackboard. Is it even going to be done by the time you get ready?
Who's redoing Blackboard?
Blackboard is getting
Yeah,
redone.
from the 20-something to the...
Everything from 24 to 26.
Oh, really?
I don't know the date.
Well, what I'll do is I'll try to put it on, once the class is over, because I just got too much stuff to do.
No, that's fine. I just was asking.
Yeah, I didn't know anything about that. Yeah. Okay. Here we go. I'm going to go over muscle and bone. Yeah.
26 to effect.
And I'm going to start with bone. So basically, what I want is the parts of the bone, yeah, and then its basic anatomical structure, and then just a little bit of the physiology. Okay? All right. Watch. Bone is made up of 2 compounds. It's made up of calcium and phosphate. Whoop, PO4. You got me? And the combination of calcium and phosphate is called hydroxyapatite. Whoop, TIT. Hydroxyapatite. So bone is hard. And 99% of all of your calcium in your body is stored in your bones. And bones are used for support, movement, protection, and as a storage area for minerals, specifically calcium and phosphate. Some magnesium stored there too. All right? So if you recall, when we started talking about the different organ systems, I talked about the fact that all organs have a saran wrap that covers the outside of the organ, and then you have a saran wrap that covers the inside, right? So bone is no different. So covering the outside of a bone is a thin saran wrap that covers the entire outside of the bone directly. And that's called the periosteum. So the periosteum is the thin outer layer of the bone. And the periosteum is loaded with these specialized cells called osteoblasts. And osteoblasts, build bone. Are you with me? Okay. Then you have the bone itself. So bone that is rich in calcium and phosphate is referred to as compact bone. And human bones, although they don't weigh a lot, their tensile strength is stronger than steel. Meaning, to compress a bone, to break it, right, it takes an immense amount of force. Now, if you angle, like if you hit the bone at an angle, it will break. But the compression force for a bone is tremendous.
What causes the compression fractures?
Like coleus fracture, like
Like, you know how some people will get a compression fracture in their back?
oh, that's usually weakening of the bone more than anything else. Like elderly people get that due to, women will get that a lot too, due to osteoporosis and the bone just thinning.
Oh.
Okay,
Oh, wait. Is that known as the cortical bone?
cortical bone. Yeah, compact cortical bone. All right. All right. Now, the inner lining of the bone, lines the medullary cavity or bone marrow. That's called the endosteum. And the endosteum is filled with specialized cells called osteoclasts. And osteoclasts break down bone. So if you ever see like a completely like a complete section of PVC pipe that's not hollowed out, it's huge and heavy, right? So what happens in the endosteum is the osteoclast will break down the bone and hollow out that medullary cavity, the bone marrow cavity. So what you're having, especially in long bones, and actually in all bones, is that you have that hollowed out middle part along with the compact bone or the cortical bone. So what it does is it allows bones to be very, very strong, yet they're very, very light. Say yes. All right. Now, in long bones, there's parts of the bone. And you have an epiphyses. You actually have two epiphyses. You have a proximal and distal epiphyses. So those are the ends of the bone. The diaphysis is the shaft of the bone, or the longest part of the bone. So you can say to people now, hey, give them the diaphysis. Okay. Say yes. All right. Inside the medullary cavity, you have bone marrow. And there are two types of bone marrow. You have red marrow and you have yellow marrow. Yellow marrow is mostly fat. The red marrow is involved in hematopoiesis, so it's going to make all the blood cells. In times where you lose a lot of blood, like severe hemorrhage, yellow marrow can be converted into red marrow. Now, with that said, fat in the medullary cavity, when people break bones, sometimes that little piece of fat that's in the medullary cavity can break off and enter the bloodstream, and those people can die from a fat embolism. So that's one of the things that doctors and nurses worry about. All right? Let's see. Oh. Watch. Hang on. All bones form joints with each other except the hyoid bone. So when they form joints, you don't want bone rubbing on bone. So all bones have this thick, tough cartilage called articulating cartilage. And this articulating cartilage cushions the joints so that you don't get bone rubbing on bone. You got me? So when you're eating that 6-piece KFC with the side order coleslaw and wedges, and you start biting on the chicken bone, and when you get to the end of the bone and you start gnawing on that rubbery part, that's the articulating cartilage. So you now can ask people, hey, how's your articulating cartilage? Say yes. Now watch. As you get older, that articulating cartilage wears away, and you will start getting bone rubbing on bone, and that is degenerative arthritis. Say yes. So here. The intervertebral discs that separate the bones of the spinal column, they're like little cushions, right? So this is articulating cartilage that's actually filled with kind of a thick jelly. It's called the nucleus pulposa. And normally what happens is you're running around, right? And these little cushions will compress, or, they'll bounce back and forth based on how much pressure you're putting on them. If you put too much pressure on it, you can rupture the little protein ring, and that nucleus pulposa can push out, and it will put pressure on the spinal nerve. And because the greatest weight and greatest stress in most people is in the lumbar region, the number one back injury are lumbar discs, where the little intervertebral little cushions rupture and then put pressure on the spinal nerve or the spinal cord itself. You got me? And what they do is they will actually remove the disc. They will do what's called a discectomy, but you have to preserve that space. So what they'll do is they will put a rod on each side and screw it into the vertebrae to maintain that space between the vertebrae. Otherwise, you're compressing those nerves all the time. So that's really how they do back surgery. Say yeah.
So when old people lose that articulated cartilage, is that what makes that noise?
Yeah, it's called crepitus, bone crepitus, where you can hear it kind of cracking and stuff.
Oh,
Yeah. So, look, watch. Now, I explained this a while back. The purpose of the ball and socket, right, the head of the femur going into the acetabulum, is to allow the leg to have a wide range of motion. If the ball was on the top and it just stuck in here, your leg couldn't do that much. So the purpose of this is to allow a wider range of motion. But look, when you're walking, the neck of the femur has a ton of stress on it, ton of it. So women, as they get older and they go through menopause, they lack estrogen. Estrogen builds bone. So you still have bone being broken down. As a matter of fact, your skeleton, the calcium and phosphate that make up your skeleton 10 years from now is different calcium and phosphate. So you are constantly breaking down bone and rebuilding bone. And one of the most powerful stimulators of bone building is estrogen. So when women hit menopause, they no longer secrete estrogen, but osteoclasts are still breaking down bone. So they get osteoporosis. So a little old lady from Pasadena, she's walking down the curb and she steps and she puts enough force on that neck of the femur and it will snap it. So if you have someone who, like elderly people who are basically healthy, what causes their ultimate demise is something like that. It's a big event, like a broken hip, or they get pneumonia or something, and they just never recover. And you can always tell if somebody has a broken hip, because when you lay them down, one leg that has a broken hip will be shorter than the other, and the leg will be externally rotated. You know they got a broken hip. And they're crying about pain in their hip, too. That's a good sign, too. Tell me you got that, right? Men secrete testosterone to the day they die. So that's why the incidence of osteoporosis in men is much lower than that of women.
Where's estrogen?
What's that?
Where's estrogen produced?
Estrogen? Ovaries. Yep. That's why women who have to have like a total hysterectomy, where they get the ovaries and the uterus and the fallopian tubes removed, then they have a greater incidence of osteoporosis. So, like, what they're doing for women now, watch, and this isn't mean, this is a fact, that when women go through menopause, then they're going downhill. Do you understand?
Does men go to andropause?
I don't know.
They go down.
My point is this, is that if you weren't meant to have estrogen circulating in your blood, you shouldn't have it. That's why back in the 60s and 70s, they were giving women estrogen replacement therapy, and they were having all kinds of problems. They were getting cancer, breast cancer, uterine, ovarian cancer. So they were like, you're just going to have to ride this out. But one of the things, just 1 second, one of the things that they did want to work with is the osteoporosis issue, because that, as people get older, it's usually a broken hip or some kind of big event that ultimately causes their demise. So they came out with these drugs that it doesn't build bone, it just prevents bone from being broken down. So you've heard of Fosamax, Boniva, right? Those prevent osteoclasts from breaking down bone. So the bone doesn't get any thinner, or any thicker, it just doesn't get any thinner. Say yeah. What was your question?
For a woman that's medically put in menopause, does her estrogen levels then stop or like lower?
Yes.
And at risk?
Yes.
Even if they do
Yes.
They should take them.
Yeah, for young women who, like, you know, chronologically have not gone through menopause, usually doctors will give them some estrogen replacement therapy because it makes sense.
Well, yeah. I was only supposed to be in menopause for 6 months and they kept me in it for a year.
Why?
I
Get pregnant.
did.
Get pregnant again. There you go. That'll help.
Yeah, that helped a lot. But the scars didn't really bad, but
Just keep popping out fetuses until you're like 90. Okay, tell me you got that, guys. So you need to include in your answer the effect of osteoblasts and osteoclasts. Say yeah. Guys?
Yep.
Okay. All right.
Wait, one more thing. Why is it continually breaking down? Like, I know that it does, you just said it, but why? What's the purpose of that? How does that make sense?
I don't know. I don't know. Yeah, you're right. I don't know. I don't know.
We shed skin too, right? Like
What's that?
we have new skin all the time.
Yeah, I don't know why that makes sense either. I really don't want to talk about it, can you tell?
He does know.
Not at all.
Right. That's beyond the scope of the course. Here we go. Muscle. Okay? There's a fractile nature to muscle. You got me? Watch. Muscle is connected to bone by tendons. Are you with me? So tendons are the thickened end of muscle. And then working from outside to in, you have a thin saran wrap that covers the entire muscle. And that's called the epimecium or fascia. Are you with me? And the muscle itself contracts within that fascia. So the fascia doesn't contract, the muscle inside it contracts. Are you following? Now, where tendons connect to bone, the bone becomes thickened. So those are referred to as processes. So a process is where a tendon or ligament connects to a bone. And because there's added stress on there, the bone becomes thickened. Like the trochanters, the greater and lesser trochanter, muscles connect to those parts of the bone, and that's why they're thickened and enlarged. Say yeah. Okay? Now watch. Then you have bundles of muscle cells bundled in these small packages. And that's called the paramecium. So the paramecium bundles groups of muscle cells together. Again, it's the fractile nature. You got me? The paramecium bundles individual muscle cells together. And then the muscle cells are wrapped in the endomecium. So the endomecium wraps individual muscle cells in a saran wrap. So that's enough. Watch. The muscle cell, skeletal muscle cell, the functional unit is called a sarcomere. Sarcomere. That's the individual skeletal muscle cell. Are you with me? Now, invaginating and spreading throughout the muscle is a complex network of arteries and veins, as well as nerves. And nerves that innervate muscles are called motor nerves. Motor movement. Say yeah. This is what I really want to explain to you. And this is what I really want you to understand. This absolutely needs to be included in your answer. If it's not included in your answer, it's going to end poorly, that question. Inside a sarcomere, there are two major contractile proteins. They are called actin and myosin. Inside the sarcomere. So the individual muscle cell is made up of a group of proteins called actin and myosin. Who's with me? So, watch. Remember we talked about Starling's law? Remember that? This right here, this protein right here, the blue one, is actin. And then you have this thickened red one with the little knob sticking off of it. That is myosin. Now watch. In order to contract a muscle, the myosin has to connect to the actin. Who's with me so far? So watch. There's a multiple guess version of the final too. Just so you know. What's that? Okay. Hang on. Wait. Just a second. There's 2 accelerated advanced classes this summer too, over 6 weeks.
I don't think any of us are going to take those besides yours.
For real? I'm okay with that. Do you know why? You've been informed. Okay. Yeah. Got to get my ghetto glasses on here. Hang on. It's almost over. Now I got 24 emails from people bothering me. Yeah, that irritates me. Don't bother me. I don't like that. Just wait, I'm doing the best I can, right? If I didn't have to record it, this computer would move a lot faster. Remember that. Hang on. Here we go. Okay, watch. In order for a muscle to contract, it needs to be stimulated by a motor nerve. You got me? What's the most important element in muscular contraction? Calcium. Write this down. Calcium for skeletal muscle contraction is stored inside the skeletal muscle cell. It's stored in an area called the Sarcoplasmic Reticulum. The Sarcoplasmic Reticulum stores the calcium for muscle contraction. Are you with me? So watch. And I'm going to cut to the chase. When a skeletal muscle is stimulated by a motor nerve, it causes that electrical impulse to travel over the muscle cell membrane, right? And the muscle actually lights up. So when you're contracting your muscles, they're lighting up. This green area is called the sarcoplasmic reticulum. What does the sarcoplasmic reticulum store? Calcium. So when that electrical impulse travels over the muscle cell membrane, it will open up voltage-gated calcium channels on the sarcoplasmic reticulum. And calcium floods into the actin and myosin filaments. Watch it. And you have little springs there too. When you get old, that's why your muscles creak. I'm making that one up. Okay, watch. In this video, what you have is you have myosin. You got me? And then hanging off the myosin, let's go back just a touch. So you got myosin, and hanging off the myosin, what appears to be blue chicken legs is what's called the myosin head. You got me? And you're not going to believe this. Get ready for this. Get ready. Who's ready? Anybody ready?
We're all ready.
Oh, that's good. Sitting on the myosin head is a molecule of ATP. Okay, watch. This little red ball here is calcium. You got me? So calcium somehow has to make the blue chicken leg connect with the partially chewed beer nuts. This is actin right here. Are you with me? But the blue chicken leg can't bind to the actin molecule because a little licorice whip called Tropomyosin is blocking the binding sites on actin. Are you with me? So watch. Do you see this little yellow thing that looks like a partially chewed piece of banana bubblicious bubblegum? This guy right here is the Troponin Complex. Anybody work in an emergency room? Anybody work in a hospital? Anybody want to be a nurse after taking this class? You do? Yeah, you want to go to welding or horticulture. Say yeah. All right, watch. Calcium's going to bind to the troponin complex, and it causes the tropomyosin to twist out of the way. And that allows the blue chicken leg to bind with the partially chewed beer nut. Are you with me? So observe. Here comes calcium flooding in. It's going to bind with the partially chewed beer nut. The tropomyosin is going to twist out of the way. You got me? And that's going to reveal the binding sites for the blue chicken leg with the partially chewed beer nut. What sits on the head of that partially chewed beer nut? ATP. Watch. Now, if you look, you got myosin connected to actin. What's on the myosin head? ATP. And when the myosin head binds to actin, ATP is broken down to ADP plus energy. And that will swing that myosin head. And because it's connected to actin, when you're pulling actin, you're contracting. When this camper's a rocking, don't come a knocking. Do you remember those stickers?
So when you're not medically active, it just relaxes and doesn't.
Right,
Just lets go.
right. The connection lets go. Now watch. When it swings, right, it contracts the muscle. To relax a muscle, a new ATP that you made through metabolism has to bind to that myosin head. And when it does, the muscle relaxes. Say yes. Now, this is what I want you to know. Watch. This is what I want you to know. I want you to know the two most important elements are, the two most important proteins in muscle contraction are proteins, actin and myosin, right? And in order for actin and myosin to connect, what do you need? You need calcium. And where's calcium stored in skeletal muscle? Sarcoplasmic Reticulum. Say yes. So when calcium's released, it is going to cause the myosin head to bind to actin. Say yes. And ATP is going to be...
Myosin?
What did I say?
You said it binds to actin. Doesn't it bind to the myosin head?
No. See, I was right. See? Don't listen to her. I was right. I got degrees. So when calcium binds to the troponin complex, it's going to cause the myosin head that has ATP on it to bind to the actin. Say yes. And when that ATP gets broken down to ADP, it will pull the actin molecule along with it. Say yes. Guys?
Yep.
And the more calcium that's released, the more connections you make between actin and myosin. So the stronger the contraction. Say yeah. Okay, that's that. Are there videos on male and female reproduction? Let me look.
On the list, you have the classical and the
I can't hear you.
on the list for the bones that you gave us. You still haven't gone over the classical.
Fascicle?
It's on the list.
For bones?
Yeah, no muscles.
Oh,
And the acetylcholine.
acetylcholine's on there?
Yeah.
Oh, okay. Watch. The fascicle is the saran wrap. And the nerves and blood vessels that wrap a group of muscle cells. You know what? Don't even worry about that. Take that off. You don't need to worry about that. The most important thing that I want you to get is what tendons do, and then ultimately the proteins that make up muscle contraction, the actin and myosin. Because you're going to be dealing with the physiology behind it. You need acetylcholine. Acetylcholine is the neurotransmitter for skeletal muscle contraction. Right? We talked about nerves and how they release neurotransmitters. Yes? The neurotransmitter for skeletal muscle contraction is always acetylcholine. Always. So yeah. All right, hang on.
And then for the bones, could you explain the fascial plate?
Oh, I didn't. Yeah, you're
and
right.
the
I didn't.
spongy bone?
I didn't.
It's just, it's the
For the questions for
I found a slide.
on 27 and 28.
Okay, let's go back to this real quick. All right, we're talking about bone here again.
Which one are you going over?
I'm going over bone. I'm going over bone. Bone. I'm going over bone. Watch. In long bones of the body, there are an aggregate, a ton of these cells called osteoblasts. What do osteoblasts do? They build bone, right? So you have a distal epiphyseal plate and a proximal epiphyseal plate. And they're loaded with osteoblasts. So what they do is they lay down calcium and phosphate and they make bones long. Right? That's how you grow. Who's following this? So estrogen and testosterone stimulate these epiphyseal plates and cause the bone to get longer. Who starts having estrogen first? Women, right? So that's why women in 7th, 8th grade, they're taller than some of the boys, right? Because they have estrogen circulating. Now, these epiphyseal plates seal and become part of the bone in women at about the age of 17. In men, the epiphyseal plates seal at 24. So how tall you was at 17 is how tall you is now.
So I'm not growing.
You know. We'd make fun of your height if you had any. I'm just... Desiree catches up on her sleep in this class. She looks so comfortable. You should bring a pillow and a little teddy. Tell me, yeah, you got that. What was the other thing I had to go over?
Spongy bone.
Oh, yeah. So spongy bone is usually found in the ends of long bones or flat bones, right? And it is an area for blood vessels to enter or leave. All right, and it's flexible too. This is joints a little bit of range, so you know if you take a sharp movement, you don't crack a hip. Say yeah. Did we do that?
Okay.
Did I go through all the parts?
Yeah.
I did all the parts. Okay. And just let me look. Yeah. You could have looked this stuff up on your own too. And then you say, well, what are you for? Well, watch. Do you realize how much work I've done for you guys? I'm sick of it. In the advanced class, I don't even do nearly that much work. It's teach yourself. I'm trying to get people not to take my class so there's less students in the summer. And there's less work and more time for me. Okay. Hang on. Here we go. Male and female reproduction. You want me to go over it?
Yeah.
Or you want me to watch the video? You want to watch the video? You want me to go over it? What a bunch of... Okay. Thanks, Terry. Okay, so make sure you watch the video too.
How long is it?
It's 45 minutes. Well, guess what? It's going to take me 45 minutes to go through it. Because I'm going to redo the video. So what? You never stayed till 5, right? That's why I made the videos. You know who had it down? Do you know who Scott Stieg is? He was a chemistry teacher in Kenosha. Students would come to him during his office hours, and they would say, hey, I got questions about that. He goes, go to academic support. That's what they're there for. Right? So in the advanced class, that's what go to academic support. That's what they're there. They get paid. Go bother them. Leave me alone. Okay, here we go. This is the female reproductive tract, or the symbol for the Texas Roadhouse.
Now every time I look at it, that's what I'm gonna see.
Okay, here we go. All right, watch. Do women have gonads? Yes or no? Gonads. Can you kick a woman in her gonads? Yes. They're the ovaries. So the ovaries do a couple of things. Number one, they secrete the hormone estrogen and progesterone. And they store, mature, and release eggs. Another word for egg is ovum. Are you you with me? Now, the ovaries are not directly connected to the fallopian tubes. Instead, the fallopian tubes have a widened part here, and that widened part is called the infundibulum. So it's a widened part. And then as you can see, you have these little projections here that look like little baby fingers. Those are called fimbriae. And on the fimbriae are cilia. So when a woman ovulates, she releases an egg. The fimbriae will contract along with the cilia and draw the egg up into the fallopian tube. The fallopian tube is a hollow muscular tube. It is lined with mucus and cilia, and it will draw that egg upward and in to the fallopian tube. Say yes. All right. The fallopian tubes connect to the uterus at the top part of the uterus. The top part of any hollow muscular organ is called the fundus. There are 3 layers to the uterus itself. You going from inside to out. You have a thin vascular layer called the endometrium. Then you have the thickest part of the uterus, which is called the myometrium. And then you have the epimetrium, which is thick, tough connective tissue that helps support the uterus in the pelvic cavity. So it helps support the fallopian tubes and ovaries so they're not flopping on the side of the uterus. So, and then you have the body of the uterus from here to here. So you have the fundus, the body, and then as you can see, it narrows into the cervix or neck of the uterus. The opening in the uterus is called the os. So this area right here is the cervix, and the os is the opening, so that if you bump ugly with the dude, that sperm has an opening to swim through and fertilize that egg. You got me? Now, the vagina is merely a receptacle for the male reproductive apparatus. And it is a hollow muscular tube that has recesses in it called fornices. That's where they get the word fornication. So There's these little recesses here, and then the deeper ones called the fornices. So when a male ejaculates into the vaginal vault, the seminal fluid will settle in the recesses of these fornices, and they're more likely to become pregnant. Now, a woman is more likely to become pregnant if she has orgasm during coitus, and the reason for that is when a woman has an orgasm, the muscular wall of the cervix will actually contract back and forth and work like a suction device to suck the seminal fluid into the uterus. That's a fact. Now, when a woman is ovulating and she is impregnable, she can get pregnant, the woman will actually secrete mucus, and this mucus actually has protein strands in it. And these protein strands allow the sperm to kind of grab a hold like a rope at a ski resort and kind of, I'm not kidding, and be drawn towards the egg. And so it makes sense, right? When a woman ovulates, she wants to get pregnant. Physiologically. So her sexual desire goes up when she's ovulating because that makes sense. That's why if a woman's not in a relationship, there's a chemical that's released in the brain called phenylethylamine, right? And that makes a woman more sexually active. If they're not in a relationship, a lot of women like eating chocolate because that has the same chemical in it. That's why they crave chocolate around there, that time that they're ovulating. Or you can just call a friend. Call a cop. Tell me you're following this so far. Okay? And here we go. Watch. And you're not responsible for this. I'm just going to explain this, okay? I'm just going to explain how the hormones affect the menstrual cycle and whatnot. First of all, the hypothalamus is connected to the pituitary gland. And you're not going to believe this, but every 28 days, the hypothalamus releases a hormone called gonadotropic releasing hormone. And gonadotropic releasing hormone stimulates the pituitary to release a hormone called follicle stimulating hormone, or FSH. And that stimulates the ovary to begin to mature a follicle. Let me explain what a follicle is. A follicle is a group of cells that contain the ovum. You got me? That's a follicle. So a woman has a bunch of follicles in each ovary, and when gonadotropic releasing hormone is released from the hypothalamus and stimulates the pituitary to release follicle stimulating hormone begins the process of maturing follicles. Many of these follicles are matured, but only one wins, right? The other ones that were maturing basically disintegrate, and you lost that opportunity to make a kid out with that. So follicle stimulating hormone matures this follicle. Once the follicle is mature, it will begin to release two hormones. It will begin to release progesterone and estrogen. Estrogen feeds back on the pituitary and says, look, we're in the process of maturing some follicles here. We don't want any more follicles to be matured. We're straight. You got me? The function of progesterone is to thicken that endometrial lining in anticipation of coitus and fertilization of an egg. So that's what progesterone does. Now, once the follicle has completely matured, estrogen levels rise. And when estrogen levels rise, that stimulates the pituitary to release luteinizing hormone. Luteinizing hormone says to the mature follicle, rupture, buddy. And that's exactly what it says. Rupture, buddy. And when the follicle matures and it ruptures, it releases the egg into the fallopian tube. So if you want to know when you're ovulating, you get a little pregnancy or a little kid at the CVS, and it checks for luteinizing hormone. And if the luteinizing hormone is rising, you are ovulating and you are ready to make a baby. Say yeah. Yeah, temperature too. I just say keep on practicing. Because remember, the best thing about kids is making them. Say yes.
So when you get sterilized, how does that affect those hormones?
When you get sterilized?
You get fixed. So it affects them to be
It doesn't affect them at all.
Just cut the
Yeah. It just doesn't allow the sperm to meet your egg. So you still got all that going on. You still get your period and everything else, right? You should. If you get a total hysterectomy where they remove the fallopian tubes, ovaries, and uterus, then that all stops. Tell me you're following this. Now watch. When you rupture a follicle, this follicle has a name. It's called Billy. Billy follicle. It's called the corpus luteum. And the corpus luteum continues to release progesterone. What's the function of progesterone? I could tell you were really paying attention there. It maintains the thickened endometrial lining, right? Now watch. If you decide, hey, you know what? This class sucks. I'm really going to take somebody else this summer, and it's probably going to be easier, so I'm going to have a lot of time on my hands. And so I'm going to go to the Blue Sombrero, and I'm going to meet Chad there. Chad, you know, he's got the little alligator on his shirt. He's got a scarf, too. Wears a scarf. And drives a Camaro. So you decide, I ain't studying, and you bump ugly with Chad. And Chad drops a load in the vagina there, and you fertilize that egg. You got me? Watch. When that fertilized egg implants in the lining of the uterus, the specialized cells within the lining of the uterus release human chorionic gonadotropin, HCG. And you're pregnant. The function of human chorionic gonadotropin is to feed back on that corpus luteum to continue to release progesterone and maintain that thickened endometrial lining. If it doesn't, you decided, you know what? Tim is the greatest teacher in the history of college, and I'm going to take his class, so I'm putting a tick-a-lock on it. And even though I'm ovulating, I'm not going to have any sex, right? So with no sex and nothing to fertilize it with, you're not going to get an implantation of the egg in the uterine lining. So you won't produce human chorionic gonadotropin, and therefore you won't feed back on the corpus luteum to produce progesterone. There's a drop in progesterone, and you get your period. Tell me you followed that a little bit. Now watch. Birth control pills trick your pituitary into believing that you're pregnant all the time. So high levels of progesterone are only present when you are pregnant. So most birth control pills have progesterone in it. And as a result, that in your blood will trick the pituitary saying, well, she's pregnant all the time. I'm not going to ovulate. And if you don't ovulate, you can't get pregnant. So the little wheel of fortune that you take, right? There's progesterone, and then the last 7 days is a placebo, a sugar pill. Then you get a small period, and at the start of the month, you start back up again. That's how it works. The depot shot, was that every 3 months?
Yeah.
Then you don't get a period for 3 months. The what? What implant? Oh, that has progesterone in it? No, that, I don't know. Oh, the IUD?
It releases over 3 years, and it's supposed to stop your period. It's a good thing for endometriosis. But it goes in your arm and they just search maybe it's still awake. But it releases the progesterone for 3 years.
The IUD, the Meridia or whatever it is, also releases a small amount of progesterone. But watch, the body does stuff that makes sense. Look, I got this twisted piece of metal in my uterus. Even though I'm bumping ugly with dude, I'm not going to implant no fertilized egg in there because I don't know what the hell that is. So it's really more of an immune response than anything else. So it alters the environment of the uterus, won't allow implantation, or in some cases fertilization. So yeah. All right. Did that make? I don't have to go over the external genitalia, do I? You got that. Well, you can figure it out, look. You know. It's on the video too. All right. Just so you know, watch. The clitoris and the penis are analogous, right? They're erectile tissue and they're very sensitive. So like when a woman takes steroids, like testosterone, her clitoris gets bigger. So does her labia majora, right? The lips, right? They will increase in size. So don't do that. What's that? If she's a bodybuilder and stuff, they'll take it. Now, what's weird is the opposite happens if a guy takes, testosterone, then his testicles actually shrink because it wouldn't make sense for the testes to release testosterone if you already got testosterone in there. Do you understand? And guys who take testosterone, their sperm count is lower too. Yeah, so don't do that. Okay, this appears to be an alien. So here's the guy's bladder. Now, watch. And then you have the testes. The testes do the same thing. Follicle stimulating hormone in men released from the pituitary stimulates the release of testosterone from the testes. You got me? Follicle stimulating hormone and luteinizing hormone also develop and mature sperm. So when you mature and develop sperm, they hang out in this area here called the epididymis. The epididymis I like to refer to as the on-deck circle for the sperm. They're waiting for their turn at bat. Now, when a guy is sexually excited, the epididymis will contract and peristaltically wave the sperm into the ejaculatory duct. You got me? And the propulsive force for ejaculation is created by these sacs called seminal vesicles. So as seminal vesicles contract, it will propel the seminal fluid out the urethra and into the vaginal vault. Say yeah. Are you following any of this? Look, looks like dude got a black eye right there. Anyways, now watch. Write this down. Write this down. This is very important. This needs to be included in your answer to get full credit. In order for a man to have sex, he has to be sexually aroused. That should be in there. You got me? Women, they can just lay there, right? And they're like, okay, is he done yet? You know. Anyways, Well, you know it's true, right? Watch. So I'll explain this in a minute. But when a man gets sexually aroused and gets an erection, then there are these glands called bulbar urethral glands that secrete a clear, viscous fluid, and that lubricates the urethra in anticipation of ejaculation. Now, when the epididymis moves the sperm into the ejaculatory duct, the environment of the vagina is acidic. Sperm need a relatively neutral pH to start swimming, so the prostate gland secretes a milky white solution into the seminal fluid, and that alkaline solution will neutralize the acidic environment of the vagina. So when the guy ejaculates into the vaginal vault, that alkaline liquid from the prostate gland neutralizes the acidic vagina, and the sperm start swimming.
Why that liquid also has a sperm on it?
What's that?
The first liquid also has a sperm on it?
The sperm first what?
That liquid that you said that goes.
The prostate gland?
Yeah.
Yeah. So
How does that happen?
all the sperm move into the ejaculatory duct, and then the prostate gland puts the prostate fluid into it, and then the seminal vesicles provide the propulsion.
So is that under conscious control?
What is it?
Like, are they able to like hold it?
Hold what? Oh, for it not, no, once they actually go through the process of having orgasm, they can't stop it. You seem disappointed. So when a guy gets a vasectomy, what they do is they cut the vas deferens. So a guy still ejaculates, it just doesn't have any sperm in the ejaculate.
So that clear fluid that prepares everything to be fertilized, is that what's called pre-ejaculation?
Right. So there's no sperm in there, so
That's just a myth that
you can get pregnant. No.
Are you,
Well, I'm not going to look, the best way to avoid pregnancy is to read the textbook. Tell me you got that. Okay, now wait, just real quick. We're almost done. Look at the video, too. It'll help you. Did anyone look at the video? No. You looked at it? How is it?
Wonderful. It's beautiful. Great job.
Just so you know, I'm sick of me, too. This looks like a bird. Okay, watch. There are no muscles in the shaft of the penis. It's not the love muscle. Do you understand? It is the love hydraulics machine. Where does arterial blood always go? So, in the shaft of the penis, there are 3 columns of tissue. There are 2 columns of corpus cavernosum, cavernous, spacious, and then a tissue around the urethra called the corpus spongiosum. The corpus spongiosum is very hard to compress. So when a male gets an erection, they pee out of the same hole they have sex, so you don't want the urethra to be compressed. Are you with me? So the corpus spongiosum prevents that. Now, wherever you have arteries, you have veins, right? And we learned there's no pressure in the veins. And each column of corpus cavernosus tissue has its own penile artery. So when a guy gets excited or he's going to go golfing, then the penile artery dilates. And when the penile artery dilates, more arterial blood goes into the corpus cavernosum. And it's cavernous, spacious, so venous blood begins to fill the columns of tissue. And as a result, they begin to expand. Who's following me? Now, the 2 penile veins that drain each column, there's no pressure. So as the corpus cavernosus tissue begin to expand because they're being filled with blood, they will compress the penile veins. So blood's going in, it's not draining. That's how a guy gets an erection. Tell me you got that. And this is very important, very important. It is parasympathetically mediated. Erection. Listen up, Desiree. So if you are yelling at your man and making him upset, it doesn't happen. Rest and digest. After he's done, you can yell at him all you want. Ejaculation is sympathetically mediated, right? So what does the sympathetic nervous system and epinephrine do to blood vessels? Please get this right. That's very good. It constricts them. So the penile arteries will become constricted. Less blood flow will go through. The blood in the penile vein will start draining, and slowly the shaft of the penis becomes flaccid. Then the guy rolls over and goes to bed. Or gets up and eats like maybe some cheesecake or something. Yeah, some juice. Tell me you got that. Now watch, and people always ask this, and it's on the video too. Distribution of blood flow can determine the direction of the penis and which way it goes. So if one column has more blood flow than the other, it can cause the penis shaft to turn to the right or left. And there are suspensory ligaments in the pelvic and abdominal wall that suspend the penis like in midair, right? So if the ligaments are strong, then the penis stands up a little more. If they're not normal, then it sticks straight out. And if it's they're weak, then it tends to go down.
But also the cervix accumulate the shape, like what's the size?
What?
This cervix of the woman, they also expand or contract depending on the size of it.
Yes. Yeah, so the cervix will either contract or relax depending on the size of the guy. Right? Just so you know, most women, the vaginal vault is only innervated the first 3 inches. And I'd like to just take a moment of silence and thank God for that. I'm just kidding.
What does Viagra stimulate?
Viagra causes penile arterial vasodilation, but it also causes arteries to dilate in other parts of the body. So that's why if you watch the commercials, right, if you take nitrates for chest pain, which dilate arteries, and Viagra or Cialis, it can cause an unsafe drop in blood pressure. That's because Q equals systolic blood pressure over resistance. So if you got chest pain and you're going to try to bump ugly with your wife or girlfriend and you take a Viagra, it's going to cause all arteries to dilate. So what's going to happen to resistance to blood flow? And that's going to drop your blood pressure. That's why. Okay, guys. That's it. Ambulate. Get out. Go.